positive, means we've done Staphylococcus family, Streptococcus family. Now we are going to go on to the venom. And what was the venom? Because these were the exceptions which were gram-negative cocci. Out of these, repeating, Neisseria, Moraxella, Veillonella. Out of these, we have to study Neisseria and Moraxella more importantly, and Neisseria is the most important one. So let's get going. We have two types of Neisseria that we are going to study. One is Neisseria meningitidis and the other one is gonorrhea. Let's start with their habitat. So do they reside normally? Yes, this is normally present in the nasopharynx. Neisseria meningitidis, it is present in the nasopharynx. Whereas what is related to the genitals is going to be the Neisseria gonorrhea. That is why it's going to relate to all the urethritis and all. Talking about the disease, no points for guessing that Neisseria meningitidis causes meningitis most commonly, and gonorrhea obviously causes a gonorrhea, which I will be telling you about how the discharge looks like. In terms of fermentation, Neisseria meningitidis will ferment both maltose as well as glucose, whereas gonorrhea will ferment only glucose. How do I learn it? See, write with me the way you write meningitidis. So you have a G also and you have an M also. But when you have gonorrhea, you only have the G. So jahan par there is only G, that will ferment only glucose. Whereas over here there is M and G, that is why it's going to ferment glucose and maltose. Easy to learn. Next, what is the shape? Can you draw meningitidis and gonorrhea for me, because that will tell you the shape. Meningitidis looks like this. If you take the parallel sides, it is looking like a lens-shaped organism, and on top of that it's going to have a capsule also, which I'll tell you. So it's going to be a lens-shaped organism with a capsule that is present. Whereas gonorrhea, if I trace it, is it looking like this? Is it, if I write a G and write another G, it's basically started looking like a kidney-shaped organism. It is a bean-shaped organism that we have. So simple. Everything is coming from the name only. Meningitidis causes meningitis. It has M and G, so it is going to ferment maltose and glucose. It looks like an M, so that is a lens with a capsule. That is the shape. Gonorrhea causes gonorrhea. It is associated with G for genitals. Gonorrhea only has G, so only ferments glucose, and the G is going to look like a kidney over here. What is common between both of them is that both of them are oxidase positive and both of them are catalase positive. Catalase ka to I hope you remember, you've seen the test earlier. The test for oxidase is this, guys. This is an oxidase test in which you get a deep purple color. So remember, getting a purple color in an oxidase test is considered to be positive. And in fact, sometimes, like over here, can you see it's a paper test? Sometimes there is a paper strip method that has been used for the same, and that paper strip method is known as the Kovacs method. So the paper strip or the Kovacs method is what is actually used for this. That is the oxidase test, and both of them are going to be oxidase positive, catalase positive also. Okay, further, which of them is a strict aerobe? So meningitidis is the one which is a strict aerobe, and gonorrhea is the one which is a facultative anaerobe. I know all of you always get confused in these lists, so all these lists I'll summarize in the end. Aerobe, anaerobes, microaerobes, all these, once you've read entire bacteriology, last chapter is going to have these. Okay, let's move forward and talk about their virulence factors. I just told you that Neisseria meningitidis has a capsule. So the capsule related virulence factor is going to be in meningitidis and not in gonorrhea. And which capsular polysaccharide, how many serotypes are based on the capsular polysaccharide? A, B, C. In order, ABC, YW135. Ma'am, do I have to learn all this? Haan, yahan par thoda sa you will have to learn, because there's going to be a vaccine that I'll make in a while out of it. Okay, so there is ABC, YW135. These are the serotypes on the basis of the capsule. There's no capsule in gonorrhea, no types over there. Both of them have outer membrane protein. OMP stands for outer membrane protein. But in gonorrhea, please note, outer membrane protein in both of them. But in gonorrhea, please note, this outer membrane protein can be of protein 1 and protein 2. Okay, protein 1, protein 2. Protein 1 is further of two types, protein 1A and protein 1B. So, pore B1A, pore B1B. How I have learnt it is that pore B1A is going to cause disseminated infection. It's basically going to involve all the organs of the body, whereas pore B1B is going to cause localized infection. How do we learn it? So, dekho, pore B1A is going to cause a lot of infection. Pore B1A is going to cause a lot of infection, disseminated infection. Pore B1B is going to cause localized infection. What else? Both of them have IgA, particularly IgA1 protease. If you can write it down, they have IgA1 protease. Both of them have endotoxin, especially meningitis ka endotoxin I'll talk about in a while. Both of them, instead of lipopolysaccharide, they have lipooligosaccharide, and they have a pili also. Now I want to tell you that for all practical purposes, iske paas flagella to nahi hai. See, Neisseria doesn't have flagella. So you will say no flagella, no motility. But still some books realized and have mentioned that Neisseria has a twitching motility. And I will say, how is that possible, ma'am? Flagella is not there, but motility is there. Yes, because of this pili. Because of this pili, there is a twitching motility that can be noted in Neisseria. So their virulence factors are also sorted. Especially yaad rakhna hai capsular polysaccharide for meningitis, because now I can tell you their transport media, their selective media. I'm telling you the common points first. Then clinical features to alag hai. Treatment is going to be different. I'll talk about common features. What is the transport media? There is something known as the Amy's media and Stewart's media. So Amy's and Stewart media is something that I can use in both the places. I can use that in Neisseria meningitis and Neisseria gonorrhea. And what do they contain? They basically contain charcoal. That is what is the commonality between them. They are charcoal based, or they are going to contain charcoal in them. What is the selective media? Again, for both of them, the selective media, many students say Thea-Martin. No, I say modified Thea-Martin. Please remember, not just Thea-Martin media, it is the modified Thea-Martin media that you have for meningitis, and the same modified Thea-Martin media that you have for gonorrhea also. So what is Thea-Martin and what is the modification that has been done? It contains 4 things. This is a question that has come. It contains 4 things. It contains vancomycin, colistin, nystatin, and trimethoprim. And out of these, trimethoprim is the one that was added in the later part, and trimethoprim basically makes it modified. Trimethoprim was earlier not there. Earlier it was only vancomycin, colistin and nystatin. So that is what was making Thea-Martin. But now modified Thea-Martin mein T add hua hai. That is trimethoprim has been added. And this is what they ask you in the exam, that what are the chemicals that are a part of the modified Thea-Martin medium. Okay, so that is about the commonalities. Now should we take them up separately? If I start off with what is the condition that happens with Neisseria meningitis, and they ask you which is the most common thing to occur, let me tell you that this is actually present in the nasopharynx. So most of the cases are going to be asymptomatic. They are just going to be carriers, and for carriers we give either IV or IM ceftriaxone. So most of them, if most common thing is asked for meningitis, they are asymptomatic carriers in the nasopharynx. But when it happens, of course, we know this is going to result in meningitis, pyogenic meningitis. But also remember, this is very, very famous for having an endotoxin, which means that not only are the patients going to have meningitis. Pehle to tell me meningitis mein kya hoga? There will be fever, neck rigidity, all these signs will be positive. But because of the endotoxin, patient will also have purpuric rash. So isse aise as it is. Pick up this line and embed it into your brain. That is, if you have meningitis, not only will you get a meningitis wala history, you will also get a rash along with it, and that is when you suspect Neisseria meningitis. Apart from that, sometimes this can also cause Waterhouse-Friderichsen syndrome. What is Waterhouse-Friderichsen syndrome? It is bilateral adrenal gland hemorrhage. These patients can also have something known as chronic, long-term chronic meningococcemia, and one more long-term thing is arthritis. Post-meningococcal arthritis and chronic meningococcemia are other features. This is about Neisseria meningitis. So how will you do the diagnosis? Of course, if you have a case of meningitis, you will take the CSF sample, lumbar puncture karoge. You can even get a nasopharyngeal swab because they are anyway inhabitants of the nasopharynx that you have. And I'm not telling you the other findings. You know they are going to look like the lens and they're going to have a capsule. You know all those findings from the common points. Okay. Now coming to the treatment. Again, as I told you, it is going to be IV ceftriaxone. There is no doubt about it whether it is carrier or disease. But if someone is allergic, what do you give? Chloramphenicol. Ye bhi pata hai from your pharmacology. I've just got you a quick repeat here. So IV ceftriaxone, whether it is disease or carriers, that is what you're giving. This is about meningitis. But now, does this also have a vaccine, which is the most important point about Neisseria that you have to know? Yes, it has a vaccine. Before I go here, do you remember it had a capsular polysaccharide? And I told you that on the basis of it, it has A, B, C, W135 and Y also that was present. Hai na? Now I have a vaccine which has 4 of these valencies. ACYW135. Basically, B nahi hota. That is what you have to know. So remember, it is ACYW135. B is not there. That is the most important question. So I can say that if someone has been given a vaccine for Neisseria meningitidis, meningococcal vaccine, that person is protected against all of these strains but is not protected against B wala. So remember, this comes as a question. Someone was given Neisseria meningitis vaccine but is still at a risk of some strain, and that is type B. Further, you want I should be able to enhance its immunogenicity. Is vaccine ko club kar do. Club it with something else. So this is conjugated with DT and TT. This is conjugated with DT and TT so that the immunogenicity increases. That is very, very important for you to know, right? Okay, now one more thing that comes to everyone's mind is that, ma'am, when do we give this vaccine? How do I decide? So I'll give you some scenarios, and those scenarios you have to again put it in your mind because it's a question. First and foremost, if you have a case of some hypogammaglobulinemia, means the person is not making adequate antibodies. Hypogammaglobulinemia is gonna be like Bruton's hypogammaglobulinemia or any antibody disorder. If a person is HIV, anyway his immunity is down. If the person belongs to an elderly age group, if the person is a habitant of Africa or some kind of travel history is given, if there is asplenia. Now guys, I think everyone knows that splenectomy patients are given these capsulated organisms wala vaccines. Why? Because spleen, now let me go into physiology, spleen protects us against all these capsulated organisms. If someone's spleen is removed, that person is at a risk of all these infections. So you will have to give him in vaccination beforehand. And lastly, if there is any terminal complement, deficiency, कौन सा वाला complement? Last वाला, especially the membrane attack complex. That deficiency also makes a person susceptible to capsulated infection. So there is hypogammaglobulinemia, HIV, age, Africa, asplenia, and terminal complement deficiency. That is when you will give this vaccine, but it will not protect against type B. This was all about Neisseria meningitis alag se. Now, what all do you have to know separately for gonorrhea? Gonorrhea is of course going to cause gonorrhea. So this means there is going to be some kind of genital involvement. So genital mein kya kya hai? I've got you a list. Dekho. So think of all, whether male or female, think of all the genitals. So in females, you can think of vaginitis, cervicitis, urethritis. In males also, you can think of urethritis, prostatitis, seminal vesiculitis. Genitals are affected. Anorectal infection can be seen. So all genitals and anorectal put in one part. What if it happens from mother to child while the child is passing through the vaginal canal? Can it get inoculated into the eyes of the child? Ophthalmia neonatorum, yes. So firstly, all the genital things, because gonorrhea, I told you, na, genital infection hai. So it's going to be all the genital things, and secondly, it is going to be a mother to child transmission in the form of ophthalmia neonatorum. Now, if they ask you, what is the further thing? If I ask you, tell me one thing for male and one for female, which is most common. So let me tell you, cervicitis is the most common in females, and urethritis is going to be the most common in males. Very important. Repeating once again for you, cervicitis is going to be the most common manifestation in females, and urethritis is going to be the most common manifestation in males. In fact, males, they will give you one line which will hint you towards gonorrhea. Urethritis means urethral discharge, cervicitis means cervical discharge. But when they tell you urethral discharge in a male patient, they will always say that there is a flow of seed discharge, basically like semen. There is a flow of seed discharge. Guys, if this word is written, they are indicating you towards gonorrhea for sure. Okay, so you've done all of these also. Now you need to know what further, what can happen. So many genital organs are getting affected. Aage kya hoga? Patient might land up with multiple discharging sinuses. Discharging where? On the skin. There might be like a water can. You've seen that can with which you give water to the plants? They have multiple holes not for water to come out. Similarly, multiple discharging sinuses is known as water can perineum. What further can happen because of gonorrhea? There are two more complications known as Fitz-Hugh-Curtis syndrome. This is nothing but perihepatitis. Fitz-Hugh-Curtis syndrome is perihepatitis, and this is also seen with chlamydia. This I will be teaching you in the later part of bacteriology. This is also seen with chlamydia. Secondly, it can cause all over the body infection. There can be disseminated gonococcal infection. Can you tell me, guys, I have taught you which is the protein that is going to cause it. Pore B1A or pore B1B. So I just told you pore B1A will cause a lot of infection. Na? So it is going to be pore B1A causing disseminated gonococcal infection. And you will say, ma'am, disseminated matlab what all organs of the body are affected? There is involvement of skin. There can be involvement of joints. There can be, when I'm talking about joints, I can talk about tenosynovitis also. Again, there can be involvement of the brain, so meningitis, and endocarditis, matlab there is involvement of heart. So some people also learn it as the mnemonic, which I'm going to put up in front of you, and that mnemonic is date me. That mnemonic is date me. So that tells me dermatitis, arthritis, tenosynovitis, meningitis, and endocarditis. But actually, honestly telling you, you don't need this mnemonic, because the fact disseminated means only that head to toe everything's gonna get affected. And what is Fitz-Hugh-Curtis syndrome? Fitz-Hugh is just the involvement of the hepatic, perihepatitis is seen. So they might give you a picture, or they might give you an explanation that there is inflammation around the liver, or there are some fibrotic bands, something around the liver is happening. Perihepatitis situation is happening. That is Fitz-Hugh-Curtis with gonorrhea, with chlamydia. Now coming to the diagnosis of Neisseria gonorrhea. You know the sample. Depending on what your situation is, if you have a genital discharge, take that discharge. If you have some involvement of disseminated gonococcal infection all over the body, you can take a blood sample. Brain ka involvement hai, you can take a CSF sample. So depending on your site of involvement. And what is the microscopic? This same picture has been asked a million times in the exam. So please zoom in, and all of you can see that there is some kind of an organism which is present as, can you see, diplococci. They will always double, as a double, they are always present in pairs. So they always mention that there is a gram-negative diplococci. See, pehle to as soon as they will mention gram-negative cocci, anyway my options are venom. Velonella, Neisseria, Moraxella limited. Along with that, if they had mentioned some genital discharge, I know that genital ke saath gram-negative cocci has to be Neisseria gonorrhea. And how do you treatment? Of course, the same ceftriaxone, but you also combine it with azithromycin for the treatment of gonorrhea. And that definitely wraps up your entire gonorrhea and meningitis, the difference between both of them. This is something which is very important. But this was not the only gram-negative cocci. Just quick words about this Moraxella also, exactly 2 slides. There is something known as Moraxella cataralis, and remember C for C, because this is very famous for COPD exacerbations. That is where it is very famous. Usually, see, most common to COPD exacerbations mein kaun tha? COPD mein, if there is infection, most commonly it is going to be hemophilus, na? I have taught you this in pathology also. But there can also be COPD exacerbations with Moraxella. Along with the lungs, even the ears can be affected. Otitis media can also occur. And you see something very famous known as hockey puck sign. This is important for INI-CET. What is hockey puck sign? Can you see this colony? It looks like any other bacterial colony. But can you see with this loop? I can't show it to you, but if you try to push it, this colony will push forward and will come over here like you're playing hockey. With a stick, with a hockey stick, you are putting the ball forward. So that is going to be, then from here, if you put it a little forward, it will come here. That is known as a hockey puck sign. That is what you see with cataralis. And what is going to be the treatment? Amoxiclav is the treatment for Moraxella cataralis. There's one more Moraxella that you have to know, that is known as Moraxella lacunata, and that is very famously in ophthalm responsible for causing angular conjunctivitis. Just a quick word about it that I wanted to remind you from ophthalm. That's about it. But yeah, Moraxella cataralis, it's COPD and hockey puck sign. Very, very important. So that wraps up your gram-negative cocci for all of you. The next chapter we begin with are going to be the bacilli.